All right, Lindsay. So today we're just going to talk about the pain that you're experiencing and just try to understand it for me and for you, so we can alter our treatment and to get you as good as possible as soon as possible. The first thing I want to talk about, so I noticed you have a disc disease. Do you remember any type of injury that would have caused that?
No, I was having pain, so I went and got the MRI done, and they told me I had a degenerative disc disease, but nothing. It just kind of started out of the blue.
Okay. So what I think might be occurring, so I think you're experiencing this pain, but I don't think there's any tissue damage, correct? That's what it sounds like? That you know about?
No, I mean, other than the disc, no.
No, okay. So, what I think is occurring is as you started feeling this pain, it started to become very sensitive, and your nerves became very sensitive to where even the littlest bit of movement or touch really aggravates it. And so the best way I think to explain this is, we can think of your brain as like an alarm clock, whatever you like. And as you have a stimulus near that general area, this alarm goes off to tell you that there's danger, there's pain going on. Normally what occurs is as you experience pain, so say as you step on a nail, you have some signals that go up to your brain, and they'll send some signals right back down to react and to either withdraw or to do something to limit that pain or limit the danger. But in this scenario, there's some the pain, the tolerance for pain is a lot less, which I think is due to a scenario where as you feel something, the amount of pain that you need to turn on that alarm clock is a lot less. So I guess in a picture form is, so if here's your threshold. So threshold is where once it gets to this level, that's when you're going to experience pain. So this is, we'll just leave it at this spot right here. And over time and due to some other factors, you can lower that threshold. So we'll just go right here. So now, as you can see, is if you experience something, your stimulus or your signal will go up. Normally it gets up to here before you start experiencing this pain, but in this scenario, it's only getting to here. So you're starting to experience that pain a lot more and a lot sooner. That's what I think is occurring here.
Okay.
And another thing is sometimes some social factors can also heighten the sensitivity. So any type of trauma or anxiety or even depression can make this scenario or phenomenon occur.
Yeah, I've had a lot of stress for a number of years. My home situation is not great.
Okay. So yeah, that's what I think is going on, and I think because of that, we can guide our therapy into different routes. So we can do some imagery, and like we'll talk about some things to hopefully decrease that sensitivity, so we can get that threshold back up to where it began at a normal level. Does that sound all right with you?
Sounds like a good place to start, yeah.
And do you have any questions for me before?
I don't think so.
Okay, well, thank you.